Hello doctor, for our video assignment, we are going to talk about positron emission tomography, which is also known as PET scan. So our group consists of myself, Mukesh, our group leader, Farzad, Nur Kamila, Yongyan Man, and Wang Yizu. So let's proceed to our next slide.
Scanning is an advanced medical image technologies that generated detailed image of the body using the release of positron and tomography imaging techniques as reflected in its name. Initially, PET was primarily used for tumor detection and monitoring, but advancements in technology have expanded its application to areas such as the heart, brain, and the lymphatic system, with the whole body PET system capable of tracking tumor spread and blood flow trends. Compared to CT and MRI, which focus on structural imaging, PET specializes in observing function activities, and the combination of PET with CT or MRI integrated structural and functional information, providing more comprehensive However, PET scanning faced challenges, including high equipment costs, radiation exposure, image noise interference, and the need for providing image reconstruction algorithms, all of which require further research and technological advancement to enhance its clinical utility.
Good morning, Madam Norita. My name is Yongyan Man, and today I will be presenting what is a PET scan and how does a PET scan works. PET scan stands for positron emission tomography, a non-invasive diagnostic imaging technique that provides visual images of organ function and is classified as a nuclear medical procedure. Unlike other imaging techniques like MRI, which primarily capture structural details, PET scan measure the metabolic activity within body tissues. Before the scanning process begins, a small amount of radio tracer is injected into the patient's body. Cancerous tissue absorbs this radio tracer and the radioactive signals released are detected by the PET scanner. Now that we know what a PET scan is, let's dive into how it works. The process begins with the injection of a radio tracer, which is a combination of a radioactive atom and a chemical substance. This chemical substance is chosen based on the target organ's metabolic activity. For example, in the case of squamous cell cancer, a radio tracer called fluorodeoxyglucose, or FDG, is used. FDG acts as glucose and is transported into the cancer cells, which have a high glucose uptake. Since FDG cannot be broken down, it will accumulate in these cells. Note that all tracers used in PET scan must be approved by the FDA for safety. Once the radio tracer accumulates in the target tissue, the radioactive atoms undergo positron decay. This process produces a new nuclide, a positron, and a neutrino. The positron acts like a normal electron, travels through the body, and gradually loses energy. When it loses enough energy, it annihilates with a nearby electron. This annihilation creates two gamma photons that are massless. Since both photons are massless, mass is conserved in the form of energy and momentum. Hence, both gamma photons are emitted with the same energy but travel in opposite direction as shown in the diagram. The PET scanner has detectors arranged in a ring-like structure with the patient's position at the center as shown in the diagram. The two gamma photons traveling in opposite directions strikes two detectors simultaneously. The path between these two detectors is referred to as the line of response, LOR. The number of coincident events detected along these LORs indicates the level of radioactive activity. The collected data is then presented in a two-dimensional format called a sinogram. The sinogram data undergoes a reconstruction process called filtered back projections, resulting in detailed images. That's all from me, and I will pass the time to the next presenter.
Assalamualaikum and greetings, Madam Norita. My name is Nur Kamila, and I will be presenting PET scan's anatomical localization and the changes of metabolic processes detected by the PET scan prior and after a breast cancer patient undergoes chemotherapy. Radio tracers are crucial in tumor or cancer imaging by PET scanner. It detects several aspects of tumors, such as vascularization and perfusion, transporters, receptors, expression of gene, and most importantly, the metabolic processes of the tumor, which we would like to focus on today. For instance, this is the study of visualization of glutamine metabolism in cancer cells. Cancer cells' metabolism rely on a cellular process called the aerobic glycolysis, while normal cells undergo the metabolic processes called the mitochondrial oxidation. Metabolism changes can be monitored by PET scan. This is done by medical professionals for early detection and accurate staging. This is crucial for effective treatment and improving survival rates. FDG PET scan helps distinguish malignant tumors from benign masses by tracking the uptake of fluorodeoxyglucose, a glucose analog. FDG PET scan is more efficient in detecting larger tumors than smaller tumors. Larger tumors are usually larger than 20 milliliters in diameters, while smaller tumors are smaller than 5 milliliters in diameters. Larger tumors are easily detected due to higher glucose metabolism, an indication of the malignant growth. In this study, FDG is utilized to monitor chemotherapy response. In breast cancer, the affected metabolic processes are the glycolytic activity, glutamine metabolism, fatty acid metabolism, and glucose metabolism. Before chemotherapy, there's a high glycolytic activity due to GLUT1, GLUT2, and GLT3 upregulation. HER2 positive and triple negative breast cancer shows highest glycolytic activity levels. This is associated with increased enzyme activities like hexokinase and lactate dehydrogenase, which promotes cancer cell growth. There's a shift to greater reliance on glycolysis, the Warburg effect, during post-chemotherapy, even in the presence of oxygen. Plus, the energy production pathways show that it is altered to help cancer cells adapt and survive treatment. Before chemotherapy, the high glutamine metabolism supports lipid synthesis and cell division, particularly under hypoxic conditions. Glutamine is metabolized via reductive pathways to synthesize acetyl-CoA. Additionally, metabolite productions like glutamate can alter the cellular redoxy and hence tumor growth, autophagy, and resistance to treatment. High glutamine metabolism in breast cancer cells correlates with increased invasiveness and drug resistance, particularly in HER2 positive and TNBC tumors. However, there are no specific changes occurred post-chemotherapy, which shows that glutamine metabolism could contribute to cell survival post-treatment. Before chemotherapy, de novo fatty acid synthesis is driven by FASN, a fatty acid enzyme. There is also an overexpression of transport proteins like CD36. This could be a disruption of lipid metabolic balance, leading to accumulation of signaling lipids that can promote tumor growth and metastasis. Post-chemotherapy, high-density lipoprotein levels decrease and triglyceride levels increase. This indicates potential development of lipid resistance during post-chemotherapy phase. Lastly, before chemotherapy, there's an increased glucose uptake in glycolysis, especially in HER2 positive and TNBC tumor cells. During post-chemotherapy, glucose and HbA1c levels remain stable, but slight insulin increase suggests early metabolic disruption, development of insulin resistance, and higher risk of developing syndrome and other related conditions.
Hi and Assalamualaikum. My name is Muhammad Fazan Raimi and I will be discussing about medical needs, which is the gap that PET scan aims to fill. What I mean by the gap is the clinical heterogeneity within neuroendocrine tumors, which in short is NET. NET exhibit high heterogeneity in terms of cellular proliferation and differentiation. To guide to optimal disease management, accurate prognostication of NET is vital. It is difficult to fully depict the heterogeneity using standard pathological grading, as it is often performed in the easiest to reach lesion, which may not reflect the most aggressive one. Fluorodeoxyglucose positron emission tomography with computed tomography, or can be called FDG PET-CT, addresses this gap by identifying aggressive, undifferentiated tumor clones within a heterogeneous tumor burden. This method surpasses WHO grading by detecting FDG positive undifferentiated tumor clones, which are associated with poorer prognosis. Somatostatin receptor (SST) PET-CT detects SST expressing NET but cannot identify undifferentiated clones SST expression. Now that we have discussed the gap, I will be talking about the innovation impact PET scan brings. Based on the problem regarding standard pathological grading, the integration of FDG PET-CT in prognostication can save lives. This is because FDG can identify high-risk patients, even in traditionally low-grade tumors. Patients with FDG-positive tumors show significantly shorter survival compared to FDG-negative ones. Due to this, FDG positivity often drives treatment escalation to target aggressive clones, whereas FDG-negative findings support less aggressive interventions. FDG PET-CT provide a comprehensive tumor assessment by capturing glycolytic activity, detecting undifferentiated clones or non-avid lesions. Patients with FDG-positive lesions who receive peptide receptor radionuclide therapy, which with PRRT, demonstrated prolonged survival compared to those not treated with PRRT, which based solely on SST findings.
So I'm going to talk about the limitations and improvements on PET scans. So let me present about the limitation. So the first limitation on the PET scan is patients with neuroendocrine neuroplasm can be presented in myriad ways, which plays a prominent role in aging. So this type of neuroendocrine tumor, which are well differentiated, may present low metabolic activity and cannot take up fluorodeoxyglucose, also known as. And the second limitation is low resolution, which makes it as a barrier to detect small lesion. The tumor can located near highly active organs such as the brain or heart can be difficult to detect due to overlapping signals. The third is the use of radio tracer that makes it hard to detect certain diseases, especially the metabolic activity of the hormones, which leads to tumor. The common use is FDG, but FDG may not be taken up uniformly by all types of tumors, especially the low glucose uptake cancers such as the prostate cancers. Last but not least is the false negatives can occur when tumors exhibit low metabolic activity. Certain tumor types such as the low-grade neuroendocrine tumors or lymphomas do not take FDG sufficiently, which produces detectable signals which make it harder to diagnose. So we can enhance the PET scan into, there are two ways we can enhance the PET scan into a better usage. So the first one is to combine the PET scan with CT scan technology. This combination of functional anatomical imaging in a single scan, which makes it easier to diagnose. CT scans are widely used for radiation therapy, treatment planning, and therapy monitoring by evaluating changes in the lymph node size. Therefore, there is no need for time-consuming separate PET transmission scan, since the CT pictures can be made more energetic and utilized to collect the PET data for continuation effect. So if you see at the bottom, the first picture is the CT scan, which represents as the diagram A, and then the second one is the PET scan image, and the last image is the result, which is the combination of PET scan and the CT scan together. So the image will be more clearer and easier to diagnose that. So the next enhancement we can do is to develop radio tracer. So the most common is FDG, where it can detect abnormal glucose metabolism, tumors, and other types of cancers in the body. The flaws about FDG is that it may miss small lesions during a PET scan due to the size of the lesion or low resolution. So for example, 18 MIF and 64 copper 80 SM are the example of radio tracer which can be used to detect tumor hypoxia. Therefore, this resulted in the diagnosis of many types of cancer in the head, neck, breast, lung. In conclusion, PET imaging has revolutionized diagnostics and treatment planning by integrating functional and anatomical insights, especially when combined with CT or MRI. Advanced radio tracers like FDG and specialized tracers improve tumor detection, characterization, addressing tumor heterogeneity, and enabling personalized treatment strategies. PET's prognostics value and role in clinical decision-making make it indispensable for long-term disease management. So the future advancements include novel radio tracer development, hybrid imaging with MRI, AI-driven precision diagnostics, and whole-body PET systems for comprehensive and efficient imaging. Efforts to expand accessibility, validate clinical utility through large-scale trials, and advanced theranostics hold promise for improving outcomes and broadening the global impact of PET technology.